So when I first heard the name Albert Schweitzer, I actually didn't really know a whole lot about him.
Before becoming an Albert Schweitzer Fellow, I had no idea who Albert Schweitzer was.
I feel like I had heard the name, like kind of like how you hear of all these like old scientists' names. I thought he was a scientist.
And it's really been through this program that I've learned a lot about his life and all the things he's done.
Although these young people did not initially know who Dr. Albert Schweitzer was, they are now among a select group of graduate students in the U.S. who are following in the footsteps of one of the 20th century's most admired global citizens. Hello, I'm Dr. Timothy Johnson, former ABC News medical editor and vice chair of the board of the Albert Schweitzer Fellowship. Dr. Schweitzer was and is one of my personal heroes. In the early 1900s, when working to improve the health and lives of people in Africa was frowned upon, Dr. Schweitzer left the comforts of Europe and his position as an esteemed theologian and musician to become a doctor and to open a hospital in then French Equatorial Africa, now the country of Gabon. His profound example of serving vulnerable and underserved populations inspires more than 250 graduate students across the U.S. each year to become Schweitzer Fellows.
My name is Tim, and I am a North Carolina Fellow.
My name is Sebastian, and I'm a Pittsburgh Fellow.
My name is Taz, and I am a New Orleans Fellow.
My name is Alan Shu, and I am a Boston Fellow. I work with children in Boston's Chinatown, and I run a photography club. I think the biggest reward for me is getting to know the community in Chinatown. I learned very early on that in order to successfully conduct a project, you have to earn the trust of the kids. By the time my project got running, I wasn't considered like an outsider just coming in with a bunch of cameras trying to start a program, but someone who is actually trying to help the community. I'm doing a MD-MPH program, so I'd hope to integrate the stuff that I learned in those academic programs like the medicine and the public health, but also have this portion of my life dedicated towards service, which is kind of what I'm trying to do this year as a Schweitzer Fellow.
Motivated by passion and an abiding desire to improve the health of our most vulnerable populations, multidisciplinary Schweitzer Fellows create and carry out 200-hour direct service projects that address not only clinical health issues, but also the social determinants of health, including poverty, the environment, and education.
I am Oni Tungo, and I am an Albert Schweitzer Fellow. I am working with the Mattapan Food and Fitness Coalition, addressing access or lack of access to fresh food. So the first part is managing the Mattapan Farmers Market, and at the same time working on outreach and putting together community events. This is it. Like this will give me both the support, the people that recognize that I can do it, and who really want to see me pursue whatever it is that my career goals in nutrition are.
To say that the help is mutual. I've both learned from Oni and hopefully allowed her some insight into what it means to be a community activist.
And be around people that are just as concerned and passionate about addressing health disparities.
The Schweitzer Fellowship offers a unique experience for students because it requires them to develop leadership and entrepreneurial skills to create and implement health projects while they are still in school.
My name is Patricia McClory, and I am an Albert Schweitzer Fellow. My project is oral health education here in Children's Hospital, a way to reach out to lots of kids when they're really young, when they're here to see their pediatrician. So right now I'm a fourth-year dental student, and so there's a lot of oral health work that needs to be done in the public health realm. So it's been great getting to work on oral health through the Albert Schweitzer program and having the support of the program behind me in this project.
So that's one of the things that the Schweitzer Fellowship does for me. Allow me a peer group and a place and a time to talk about the things in society that are deeply troubling and then work together to address them.
The Schweitzer Fellowship's support extends beyond the mentoring that accompanies the initial year. It continues when fellows become alumni and members of the Schweitzer Fellows for Life network. a pipeline of leaders in service that is now thousands strong. Every fall, Fellows and Fellows for Life gather for a national Schweitzer conference to network, share ideas, and find continued inspiration in each other and in the impact that they are having on community health.
Albert Schweitzer's legacy just continues to grow. And I think it's simply because he has a very simple and eloquent message, and that is make your life your argument.
Dr. Robert McCursey served as a Chicago Fellow 15 years ago and now practices medicine in the Greater Lawrence Community Health Center in Lawrence, Massachusetts.
It's a community that's medically underserved and economically deprived. It's one of the poorest communities in Massachusetts. It needs a lot of healthcare providers as well as healthcare services. It's a community that is in need and a community that I enjoy working with.
Thank you for your job.
I didn't call my mother. I think his legacy just continues to grow. I think his mantra in life was very simple. It's serve other people, and through service you gain a lot. And a lot of times you gain more than you give. You also learn a lot about yourself.
I work with the American Cancer Society in Philadelphia.
University students as a social worker / psychotherapist.
I work with Burmese refugee teens and local youth volunteers.
With the Indiana University Student Outreach Clinic.
I am an Albert Schweitzer Fellow.
I am an Albert Schweitzer Fellow.
I am an Albert Schweitzer Fellow.
I am an Albert Schweitzer Fellow for life.
Fellow for life.
For life.